Alzheimer's disease is a brain disorder. It slowly destroys memory and thinking skills. It makes it hard to do everyday tasks. The brain cells slowly die, and this causes problems with memory, thinking, and behavior. Alzheimer's is actually the most common type of dementia. Dementia is a group of brain disorders that affect a person's ability to think, remember, and make decisions. As the disease progresses, people may have trouble remembering familiar faces or performing routine activities. This disease usually affects older adults, but it can also occur in younger people, though it is less common. It's a progressive disease, meaning it gets worse over time. There is currently no cure for Alzheimer's, but there are treatments that can help manage symptoms. Anyone can develop Alzheimer's, but some factors increase the risk. Age is a significant one. The risk doubles every 5 years after age 65. Family history plays a role too. Having a close relative like a parent or sibling with Alzheimer's increases your likelihood. Certain genes can also increase your risk for the disease. Lack of physical activity, poor diet, smoking, high blood pressure, high cholesterol, and diabetes. These factors can damage blood vessels and reduce blood flow to the brain. Alzheimer's disease progresses in stages. Each stage presents distinct symptoms. Recognizing these signs early allows for timely intervention and support. In the early stages, people might experience memory lapses, like forgetting recent events or conversations, difficulty finding words or following directions, misplacing things and having trouble retracing steps, and changes in mood or personality, such as becoming withdrawn or irritable. As the disease progresses to the moderate stage, memory problems worsen, affecting daily tasks like dressing or cooking. Confusion about time, place, and people becomes more frequent. Communication becomes increasingly difficult, and behavioral changes, including agitation, restlessness, and wandering, may arise. In the late stages of Alzheimer's disease, individuals lose the ability to communicate coherently or recognize loved ones. They require full-time assistance with basic needs like eating and bathing. Physical abilities decline, leading to difficulty swallowing or walking, and complications like pneumonia and infections become more likely. Diagnosing Alzheimer's disease involves a comprehensive evaluation by a healthcare professional. There is no single test to confirm the diagnosis. The process typically includes several important steps. First, the doctor will ask about symptoms, medical history, and family history of memory problems. They will also perform a physical exam to assess overall health. Next, cognitive tests are used to evaluate memory, problem-solving, language skills, and other cognitive functions. These tests help determine the severity of cognitive impairment. Brain imaging scans, such as MRI and CT scans, can reveal structural changes in the brain, like shrinkage in certain areas that are characteristic of Alzheimer's disease. And, while not diagnostic, blood tests can help rule out other conditions that may cause similar symptoms. Currently, there is no cure for Alzheimer's disease. However, treatments are available to manage symptoms and slow the progression of the disease. When it comes to medications, cholinesterase inhibitors are often used. These drugs increase levels of acetylcholine, a neurotransmitter involved in memory and thinking, and may help improve cognitive function in some people. Another medication, memantine, regulates glutamate, which is another neurotransmitter involved in learning and memory. It may help slow the progression of symptoms in moderate to severe Alzheimer's. Therapies also play a big role. Occupational therapy helps individuals maintain their independence and manage daily tasks. Speech therapy addresses communication difficulties and helps people find ways to express themselves. And physical therapy helps maintain mobility, strength, and balance. While there is no guaranteed way to prevent Alzheimer's disease, adopting a healthy lifestyle and managing risk factors can reduce your risk. Some important lifestyle modifications include regular physical activity. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity aerobic activity per week. Eating a healthy diet is also key, so try to consume a balanced diet rich in fruits, vegetables, whole grains, and lean protein. Keeping your mind active is just as important. Engage in activities that challenge your brain, like puzzles, reading, and learning new skills. And don't forget about social engagement. Staying socially active and maintaining strong relationships with family and friends can really make a difference. Managing health conditions is also crucial. Control your blood pressure and keep it within a healthy range. Manage your cholesterol levels through diet, exercise, and medication if needed. And be sure to control your blood sugar by managing diabetes effectively with medication, diet, and exercise. Living with Alzheimer's disease presents challenges for both individuals with the condition and their caregivers. For individuals with Alzheimer's, it's important to create a safe and supportive environment, modifying the home to reduce fall risks and make it easier to navigate. Establishing a routine and sticking to a regular schedule can help minimize confusion and anxiety. Encouraging independence by allowing individuals to do as much as they can for themselves is also really valuable. And communicating effectively, using simple language, speaking slowly, and being patient can make a big difference. For caregivers, educating yourself about the disease and its progression will help you provide better care. Seeking out support groups can connect you with others who share similar experiences and advice. It's also important to practice self-care. Take breaks, engage in activities you enjoy, and seek professional help when needed. Utilizing respite care services can provide temporary relief from caregiving responsibilities. Living with Alzheimer's disease can be challenging, but with the right support and resources, individuals with the condition and their caregivers can navigate this journey with compassion and understanding.